We are going to discuss about one disease condition, that is the deafness or deaf. Okay, it is one of the sensory deficit. Okay, in this what happens means, first of all the children are lose their hearing capacity. Okay, it is one of the childhood disorder. What is the reason why the children are lose their hearing capacity? Okay. And regarding that we have to discuss. Okay, first of all, deafness or deaf, nothing but hearing loss when the present from the birth or childhood stage. Okay, the children are having hearing loss by birth or their childhood stage. Okay, their developmental stage due to some infections or due to some diseases in the ear. Okay, the children may have one symptom like loss of hearing. Okay, first of all we discussed about what is the normal hearing capacity, how the children are going to get some sound waves. Means one structure is there, no, that is the ear. Okay, here having the three substructures, that is the outer ear, middle ear, inner ear. These are the types of structures in the ear. Okay, here what happens means external ear receives some sound waves. Okay, which sound is produced within the external environment. Okay, that sound waves will be received and that will be sending to the middle ear. In that tympanic membrane is there. Okay, in that some cells is there, the cells will be received and they are give some reply. Okay, they are give some answer. Okay, they are receiving sound waves. For example, we are calling one children, means immediately the children will be give some response. Okay, hi children or hi everyone, like that we are giving some, we are producing some sound in front of children, means okay, the children will be receive that sound waves and give some response to the particular sound. Okay, this process will done by naturally by doing this anatomical structure of ear and functions of ear. Okay, in this what happens means due to some infections of the ear or due to some problems, some tumor formation, or sometimes by birth the neonates, the children will lose their hearing capacity. They are unable to receive sound waves which is produced by the external environment. Okay, in this what happens means the children are having the quiet environment. Okay, calm and quiet environment, peaceful environment will be there. Okay, in that environment they are hear some sound waves from the 0 to 25 decibels. Okay, in this what happens means the individual incapable for maintaining of meaningful auditory contact. Okay, in this deafness condition, deaf condition, the children are incapable for receiving auditory sounds. Okay, one noise, one loud voice or some short voice or what is there, some noise will be received by the children, means the children are not having any hearing loss. Okay, if they are unable to receive that sound waves, means they are having some problem of hearing loss. Okay, in these causes. Okay, what are the causes why the children are having that hearing loss? Means first of all through the genes. Means sometimes chromosomal abnormality or the genetical abnormality in the family, they are having some deafness, means that may be affected to their children. Okay, this is the one reason by the through the genes. Okay, next another one is the intrauterine infections. Okay, within the mother womb. Okay, the mother having some infections of uterus. Okay, in that structural abnormalities or functional abnormalities or some structure is there, no, uterus. Okay, uterine cavity or body or cervix or sometimes fallopian tubes. Okay, in that structurally they are having the uterus having some infection, means the infection may be spread to the fetus. Why? Because the fetus will be developed in the mother womb, that is the uterus, no. Okay, that's why the children may have some infection. The infection will be easily spread to the ear canal of tympanic membrane. That's why the children may lose their hearing capacity. Okay, that intrauterine infections like, for example, syphilis. Okay, through the syphilis infection or sometimes toxoplasmosis infection. In this, what happens means viruses or bacteria will be enters into the uterine of the mother, and that infection will be easily spread to the fetus of the ear canal. Okay, that's why the children are losing their hearing capacity. They are not receiving any sound waves by the external environment. Okay, in front of some utensils or in between some human beings or in between animals and human beings, okay, whatever it may be, which sound waves will be produced in the external environment, okay, the sound waves cannot receive by the children. Okay, next another one is some type of natal causes. Okay, through the birth, in that natal section, what happens means asphyxia. Okay, the children are not having sufficient oxygen levels. Why? Because sometimes they are not receiving oxygen, means sometimes they are swallowing some amniotic fluid, or sometimes they are not having sufficient blood supply, or sometimes respiratory problems is there, sometimes heart problems is there. Okay, in that situation they are not having sufficient oxygen to the body, then the children may have one problem of death. Okay, next sometimes the children are having the, what is that means, intracranial injuries. Okay, when they are having the mother going to give delivery through the episiotomy. Okay, in that what happens means large size of cranium is there, then crowning time. Okay, the bones will be having some injuries due to the that movements or that traveling of through the birth canal. Then the neonate may have some injuries of cranium. Okay, due to these reasons, or sometimes meningitis. Okay, inflammation to the meningeus layer, the infection will be easily spread to the one part to another part. Then the children may have one problem of death. Okay, next another one is sometimes encephalitis. Okay, encephalus layer also there, no brain covering layer. Okay, once the encephalus layer will be getting some infection, means the infection may be spread to the one part to another part. Sometimes otitis media. Otitis media, it is a one type of disorder of ear. Okay, in this what happens means the children or lose their hearing. Okay, they are not receiving any sound waves. Why? Because in this otitis media, the infection to the tympanic membrane. Okay, that's why the children or neonates or infants lose their hearing capacity. Next another one is the drugs. Okay, some drugs also one reason, one risk for hearing loss in the neonates. Okay, what are the drugs means? For example, the aminoglycosides and streptomycin. Okay, excessive use of, overdose of streptomycin or overdose of aminoglycosides. Okay, this is also one risk factor for hearing loss in the children or infants or neonates. Okay, these are the causes for the hearing loss in the children. Okay, sometimes the children are having some structural abnormalities in the ears, means sometimes tumor formation. Okay, excessive growth formation, or sometimes fluid accumulation or pus formation in the ear canal, or sometimes the tympanic membrane having some perforation, or sometimes the children are having some developmental delays or defects, birth defects. Okay, abnormal communication in between the respiratory tract and that ear canal. Okay, like that some abnormality, congenital malformations. Okay, due to these reasons also the children may have one problem, that is the deaf. Okay, these are the causes. Types of deafness. Okay, in these types, first one is the conductive deaf, another one is the sensory neural hearing loss. Okay, conductive hearing loss, first one. Another one is the sensory neural hearing loss. Okay, these are the types is there in the children. Here what happens means the sensory neural means the neurons is there, no? Through the nerve impulses, through the neurons, the sound waves will be receiving, the sound waves will be sending to the brain. Okay, the brain gives some information, some answer. Okay, the children can speak. Okay, in this what happens means physiology of hearing. Okay, that structural or functional impairment. Okay, the brain cannot receiving sound waves, or sometimes the hearing ear of the tympanic membrane cannot receive some sound waves. Okay, due to these reasons the children of the neonates may lose their hearing capacity. Okay, next clinical manifestations. How we will identify the children or the neonates suffering with the hearing loss. Okay, what are the clinical manifestations? Means first one is the children's or lack of or failure statal reflex. Okay, in this what happens means in front of neonates or in front of children's we are making some sound. Okay, we are making some sound, they are not receiving any sound waves. Okay, for example, hi baby, hello nana, like that we are give or we are producing some sound, some noise in front of children. Means the children cannot receive any noise or sound. Okay, this is the one clinical feature. Another one is the poor academic performance. Okay, poor academic performance in the school. Okay, the children having a poor performance in the school work. Okay, in this classroom work the teacher will give some what is that homework or the class work. Sometimes they are give some assignments. Okay, some picture drawing or any work is given by the teachers. Okay, the student is weak performance is there. Okay, for attention of exams or for answering questions or for attention of exams. Okay, whatever it may be, for answering questions. Okay, they are not having well performance. Okay, they are not playing with the their neighbors or the siblings or okay, their students or friends. Okay, they are not well playing or they are not well communicating. Okay, they are always weak. Why? Because what sound is produced by the external environment, that sound waves they are not receiving. Why? Because the problem is there in the ear canal of the tympanic membrane. Okay, next another symptom like the children are having the behavioral problems. Okay, they are not having good behavior. Why? Because they are not receiving sound waves. Sometimes they are taking or they are receiving misunderstanding. Okay, once one children will calling or one children will speak with the another children means who are having a low hearing capacity, those are receiving improper hearing words. Okay, improper words they are receiving. That's why their children are doing some abnormal behavior. Okay, first of all the one child is there, another child is there. Okay, this first child is calling to the another child. Okay, that another child having that hearing loss, due to that they are receiving that sound perception like she is scolding. Okay, actually she is not scolding to that particular person, but she has misunderstanding. Why? Because poor hearing performance. Okay, improper hearing capacity. Okay, that's why the children are having abnormal behavior through the friends or the students. Okay, next another one is the delayed language development. Why? Because they are not receiving any sound waves. That's why they are not speak well. Okay, for example, what is your name, like that we are asking. Means that sound waves they are receiving means immediately they are giving their name or they are giving their answer, whatever it may be, Pinky, Puppy, Pandu, Lucky, okay, whatever it may be their answer, they are immediately telling when they are receiving that sound waves. Okay, they are not receiving any sound waves means they are not having a practiceness for communication. Okay, they are developmental delay of speech. Okay, once we are communicating with other one means, okay, our communication skills will be improving. Okay, we are not communicate with the others, we are always dull, or we are not making any noise means we also that speech development will be impairment of the children's. Okay, next another one is the listening television sounds. Why? Because in that television volume, okay, high mode volume or excessive sound we are putting means that loudness, okay, that excessive noise they are receiving, okay, through the radio or through the television, the sound will be received by the children. Okay, next another one is the speaking loudly. Okay, sometimes the children who are having hearing loss, they are receiving one sound means immediately they are giving answer like loudness. Okay, loudness voice, speak loudly. Okay, always look like who are having the deafness of children. Okay, that girls or the boys they are speak loudly. Okay, this is also one symptom. Next another one is the diagnosis. Okay, in this diagnosis, first of all, as a nurse, we have to do the assessment like routine audiometric screening. Okay, how much decibels of the sounds they are receiving. Okay, they are having a high hearing loss or moderate hearing loss or mild hearing loss. Okay, depending upon we have to decide by using audiometric screening. Okay, next another one is the in front of the children is able to cooperate and the children is following some instructions means then only we have to perform this audiometric screening. Okay, if the children are unable to cooperate for conduction of this test means we are not doing. Okay, when the child is cooperate with us, then only we have performed this audio screening test. Okay, next another one is the management. Okay, in this management, as a nurse or as a healthcare providers, what care we have to provide it to the children means in this first of all we have to identify the cause. Okay, what is the cause? By birth the children are having this hearing loss or their early childhood stage due to some infections means otitis media or encephalitis or meningitis or some type of infection, viral infections. Due to that the children lose their hearing capacity. Okay, what is the exact cause? First of all we have to identify that particular cause of the hearing loss. Okay, next we proceed symptomatic treatment. Okay, if the children are having pus formation from the ears means first of all we have to control that pus formation. How to reduce means for prevention of infection, for reducing infection. Okay, if the infection is there means then only the children having the pus formation or in the ears. Okay, next another one is that the children are having some behavioral abnormalities. Why? Because they are receiving loud voice but they are not receiving small sounds. Means we have to give some speech therapy. Okay, by administration of hearing aids or sometimes we have to give some microphones to the children. Okay, then they are receiving sound and they are well speech, well communicate with the others. Why? Because they are using some sound waves, some missions for hearing. Okay, then they are developing their speech capacity. Okay, in the presence of speech, how they are speaking perfectly means by hearing only. Okay, when we are listened, when we are heard, perfectly means then only we are communicate perfectly. Okay, without a hearing capacity we are not communicate perfectly. Why? Because opposite persons, opposite children, they are giving some sounds, they are producing some noise means when we are receiving accurately, adequately, then only we have to give some answer to that particular sounds. Okay, next another one is the we have to use one surgery like cochlear implantation. Why? Because the cochlea only major or cochlea only important one for receiving sounds, for producing sound. Okay, if the children are having a surgery means we have to do that one, and we have to use encourage the children for using that hearing aids. Why? Because some children are having some shyness. Why? Because the hearing aids will be appearance by externally, no? Okay, continuously they are using that hearing aids means they are feel some shyness. Okay, as a healthcare providers we have to give some health education to the children. Why? Because don't feel shyness. Okay, by using hearing aids you have to receive sound waves which is producing by external environment. Okay, first of all your health is important. Okay, don't feel shyness. We have to prepare psychologically for the children for using that hearing aids. Okay, next another one is the if the children are having any external like sensory neural hearing loss means we have to give or we have to introduce that hearing aids, that is the cochlear implantation or the microphones using. And another one is the we have to use special education for the children. Why? Because they are group education they are not receiving. Why? Because they are having hearing loss problem. Okay, that's why we have to give group education, we are not preference. Okay, we have to give special education for the children for improving their knowledge, their skills. Okay, next another one is the don't leave alone children for which is uncomfortable area. Why? Because they are not receiving any sounds. Okay, they are facing for so many struggles. Okay, when we are listening, when we are hearing that particular sounds, then we have to do some work, no? Okay, our activities also we are doing by own means, we are receiving some sounds only. Okay, next another one is the as a nurse or as a healthcare providers we have to give some health education for home safety devices. Okay, for prevention of injuries to the children. Okay, that accidents which is done in the home level. Okay, sometimes the children are not listening some sounds means they are having some problems. Okay, that hearing loss will be improving by providing special education to the children. Okay, next another one is the as a nurse we have to give special communication to the children. Okay, why? Because the children are when we have communicate to the parents or the children. Okay, through the communication they are improving their communication capacity. Okay, if they are not having any communication, they are not starting means they are not practice means they are losing their speech problems and they are losing their hearing capacity. Okay, in early stages we have to hospitalize the children first of all. Okay, why? Because any infection is there or any surgery is needed or the problem will be cured by using this hearing aids. Okay, that will be finalized by the physician. Okay, this is the management for the children who are having hearing loss.